Good day. My name is Dr. Folike Sarimiye. I'll be presenting the paper titled Body Image Perception and Coping Mechanisms of Breast Cancer Patients Assessing Care at the TERTIARY Hospital, Southwest Nigeria. Here are the authors. I'll be following this outline. Breast cancer is a disease that is characterized by the abnormal growth of cells in the breast. It is currently the most common type of cancer worldwide, with 2.2 million cases recorded in 2020. It is also the most common cancer among women, both in developed and developing countries, and a major cause for public health concern. In Nigeria, it is the leading cause of cancer deaths currently, representing about 23% of all cancer cases, and approximately 18% of deaths are attributed to breast cancer in the country. Breast cancer poses serious psychosocial challenges among women diagnosed in resource-limited settings like Nigeria. Women with breast cancer often experience changes in their appearances and other concerns around sexual function, which may result to negative body image perception and compromise coping mechanisms. Our objectives of the study was to assess the body image perception and to determine the coping mechanisms used by the women living with breast cancer assessing care at the Tertiary Hospital, Southwest Nigeria. Our methods were hospital-based cross-sectional study. A total of 159 women who were 18 years and above with a confirmed histological diagnosis of breast cancer and have assessed care for at least 12 months in our facilities were recruited. Systemic random sampling technique was used. Data was collected with a self-developed social demographic instrument. A 10-item scale developed by Hopu et al. Was used for body image perception assessment. The brief code by Cavallo et al. Was used to assess coping mechanisms. Data was analyzed using SPSS version 22. All analyses were carried at 5% level of significance. Ethical approval for this study was obtained. The social demographic characteristics are presented in Table 1. Majority of the women were above 40 years. The tertiary education had the highest sum of education attained by the participants, and then the monthly median income of the participants was 18,000 naira. The clinical and treatment characteristics of the participants is presented in Table 2. Majority of the women, about 75% of the women, had been diagnosed with breast cancer for more than 3 years at the time of recruitment for the study. About 41% of the participants were diagnosed at stage 2. As stage 2, 60% of them had undergone mastectomy, and 15% of the patient had a family history of breast cancer. Figure 1 shows the body image perception assessment. Almost half of the participants showed that majority had at least had a low poor negative body image perception. Table 3 shows the coping mechanism subscales. It shows that religion had the highest was the highest form of coping mechanism employed by the participants, and followed by active coping and then instrumental support. This table shows the relationship between body image perception assessment and coping mechanism. It shows that there's a significant association between employing coping mechanisms such as active coping, religion, and using instrumental support with positive body image perception. In this study, about half of the respondents reported having negative body image perception expressed in various forms. Religion was the highest coping mechanism among the subscales employed by the participants in the study. This is consistent with the previous studies from Nigeria. Studies have shown that women with strong religious beliefs report less feelings of distrust and hopelessness about having breast cancer, and were likely to maintain a positive mental attitude despite their condition. Active coping was also used by participants in the study in dealing with the challenges of breast cancer. This is in line with the previous research, which has found that active coping results in more active coping results in more positive adjustment over time, with some patients reported higher emotional support. Conclusion and recommendations are these: that this study shows that religion, active coping are the most preferred coping mechanisms, and the likelihood of maintaining positive body image perception after initial diagnosis and subsequent treatment for breast cancer. Support systems such as support groups, psychotherapy sessions can be set up for women with breast cancer within the religious circles, with support from the formal healthcare system and healthcare professionals. This will further enhance positive coping skills and reduce the impact of psychosocial burden of breast cancer, such as negative body image perception. Thank you for listening.